Hi, my name is Wayne Guerra, and I'm the co-founder and chief medical officer of iTriage. Kidney stones are small, hard particles that get into the kidney and then the ureter. The ureter is the tube that connects the kidney to the bladder. If the kidney stone, and typically they're made of calcium oxalate, but they can also be made of uric acid, struvite, and cysteine. But typically if it stays in the kidney, it doesn't cause any problems. It's when it enters the ureter and blocks the urine from the kidney to the bladder, that's when you get the symptoms and the problems with the kidney stone. Yes, you can. I mean, the most important thing is to drink plenty of fluids and to stay hydrated. Kidney stones are more common if you're obese, if you've had a family history of kidney stones, if you eat a high protein diet, if you've had a gastric bypass surgery. But the most important thing is to stay hydrated, drink plenty of fluids, and to keep that urine flowing. If you do get a kidney stone, it's important for your doctor to determine what type of kidney stone it is, because they can, depending on what the kidney stone is made of, change your diet to help you prevent from getting additional kidney stones. So typically, if you're like seeing an emergency department with a kidney stone, they'll send you home with a strainer, have you strain your urine, and you're looking for something that's very small, like a grain of sand. 2 to 6 millimeters is the typical size. It depends on the symptoms, but if the symptoms are severe, like severe pain and vomiting, you'll receive medications for that. If they can control your vomiting with pills and your pain with pills, then they'll just use pills. But many times, especially patients in the emergency department, we require intravenous medications for pain and vomiting. And then they'll also give you IV fluids to keep the urine flowing. It depends on, further treatment depends really on the size of the kidney stone. They'll typically do a CT scan or abdominal CT scan, also called sometimes a renal CT scan, to determine where the kidney stone is and the size of the kidney stone. If it's less than 6 millimeters, then you'll almost always be able to pass that on your own. Kidney stones larger than that sometimes need a procedure. There's a couple different kind of procedures that can be done. They can do an open procedure where they make an incision in the back and then pull out the kidney stone, or they can do a scope that goes through the bladder and into the ureter and either push the kidney stone back up into the kidney, where then they can do sound waves or lithotripsy to break up the kidney stone, or they can grab the kidney stone and pull it down through the ureter and